Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Our topic today is congenital heart disease and blood clots. My guest is Michael Silvey. He is a pediatric hematologist and oncologist and is part of the hospitalist team at Children's Mercy Kansas City. Dr. Silvey, welcome to the show.
Thank you very much.
So when we look at the increased risk for blood clot in kids with congenital heart disease, what type of risk are we really talking about here?
Well, there's actually several risks for these patients to develop blood clots. Number one, patients with congenital heart disease, specifically, patients with, single ventricle physiology, they need to undergo multiple surgeries to correct their defect. And so when they have all these surgeries, they have a lot of time in the ICU, so they're going to be monitored very closely and have central lines. And central lines have been shown to increase the risk of developing thrombus in pediatric patients. And so these patients have 2 or 3 surgeries, so they're going to have multiple central lines at the same time. So that's one of the big risk factors. Another risk factor is the actual surgery themselves. Sometimes during these surgeries, they create artificial, shunts, and they put shunts in these patients, which creates low blood flow states, and that's going to increase their risks too. So it's really multifactorial for these patients.
Yeah, and so Children's Mercy now is taking what you guys are calling a multidisciplinary effort or approach to handling this in this patient population. Tell us a little bit about how you guys approach children that are at risk for the blood clots and how you treat them and what kind of improvements in outcomes you've made.
So, trying to figure out who's at risk for blood clots in pediatric patients is really hard to predict at this point in time, just because we don't have any data on that just yet. So we're really trying to focus on, identifying patients who are at risk of developing blood clots. So for patients, on the floor, we, make sure the teams are aware if they're, immobilized. We need to make sure that, they're either moving around or they have some sort of prophylaxis to try to prevent them from having blood clots. So we work with the hospitalist all the time with that. We work on our general hemonc service as well, in strategies and trying to prevent this. And the ICU does a great job too as well. And, thinking about that every time that they're around, is this patient at risk of developing a DVT? Do we need to do something about that? So we work hand in hand with a lot of services to try to prevent the development of these blood clots.
And how many patients do you guys see every year that you have to treat for blood clot or that you're following because they might be at risk?
So we see about, I would say, around 70 to 80 new blood clots a year in the hospital. Those are patients that come into the hospital admitted for blood clots or develop blood clots while they're in the hospital. And over the past 3 or 4 years, we keep on seeing those numbers slowly increasing over time.
So where do you? So here, Dr. Silvey, we obviously this is a serious complication for these children, right? And we definitely want to identify them, prevent the clot in the first place. But if they get it, it can have horrible consequences in this patient population, right? So where do you see the future of this going? Like, what is there any new treatments, new screening tools out there? Where does Children's Mercy kind of stand as an innovator in this?
So the biggest question we really need to ask is what put these patients at risk for developing blood clots? And again, like I said, there's really no data out there to say, you mentioned a screening tool. We don't have a screening tool right now. One of the things that we have done is we've actually partnered up with the Children's Hospital of Los Angeles, the Children's Hospital of Colorado, and the Children's Hospital of Orange County, and we're part of what's called the Children's Hospital Acquired Thrombosis Registry, or the CHAT registry. And what we're doing is we're looking retrospectively at patients who did develop blood clots in the hospital and trying to identify specific certain markers, central lines, infections, surgeries, what types of surgeries, what could have increased the risk of developing blood clots. And once we have collected enough patient data, hopefully we'll be able to develop a nice screening tool to help try to see, okay, this patient had surgery this date and had a central line on this date. This patient is at risk for developing clot versus another different type of patient. So we're partnering up with them to kind of help develop this screening tool and hopefully use that prospectively to see, okay, this is what we really need to do for these patients.
And so when you're able to put all this together, you'll be able to review kind of what that patient has gone through. this, maybe you end up giving them a number. This person's at X at risk for a blood clot because they've gone through X number of things, procedures, what is it? And then you can start laying out preventative care, right? Maybe in some patients it's as simple as being more, more mobile, and others it's actual medicine. So that's kind of where you're moving with this type of data, correct?
Yes. We're trying to find the best way to screen these patients and say, okay, so this patient cannot get out of bed, so let's go ahead and put, serial compressive devices on their legs, just kind of prevent a lower extremity DVT. Or, okay, this patient probably needs to be on some sort of chemical prophylaxis, so we'll start them on some sort of anticoagulation before they develop a blood clot.
So as all this data is being gathered right now, I mean, how far away do you think you are, or Children's Mercy is, from kind of developing a nice screening survey of what a patient's gone through to predict risk?
So hopefully over the next couple of years we'll be able to develop the tool. It does take a lot of time to collect all this data because, again, it is retrospectively, and we had to have enough manpower to do it, to look back through all these patient charts. So hopefully within the next 2 or 3 years we'll be able to kind of develop this tool and be able to utilize it.
Gotcha. Well, what great work that you're doing, Dr. Silvey, and I want to thank you for working with Children's Mercy on this incredibly important issue, and good luck to developing that screening tool. And thanks for coming on the show this morning. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.